The key challenges in Newark and Sherwood relate to the fact that we have a very diverse population spread over a very wide geography.
There is a market town and there are a number of quite rural areas and quite isolated areas.
We have the smaller hospital across in Newark, which is delivering some excellent services. We also have the larger hospital across on the other side of the patch in Ashfield, from which most of the acute services are provided.
And there are very different levels of affluence and deprivation across Newark and Sherwood, and trying to meet the needs of all of those people can be very challenging.
At the moment, often practices work very reactively, so you're caught out sometimes by patients with big needs, and I think our clinicians are often frustrated that they can't do as much as they'd like for their patients and do enough in their homes. So PRISM will be a great asset to the practice team, and rather than the trend being for patients to come from us into hospital, it will enable a lot of the specialties that are in hospital to come out into the community, and for us to be at the kind of the hub of that team in caring for those patients better.
What we're doing about it is completely redesigning the way that we look after our patients with long-term conditions. We're doing it at praxis level within the surgeries, and we're also doing it out in the community. We're redesigning all of the patient care in the community to make it much more joined up.
Importantly, I think we use the key phrase, the mantra, which is no decision without you, and that's the key part of this. The patient is at the centre of their own care. So healthcare, local support, voluntary support comes to them, or is provided for them and their carers. And importantly, it cuts down the hospital admissions for them, hopefully, and we can look at prevention.
I think the fundamental strengths of this organisation is the amount of clinical input that we have, and also the amount of our patients that get involved with the services. When I first started with clinical commissioning some 3 or 4 years ago, there were maybe a handful, less than 5 general practitioners from the local area that were involved in commissioning. Now we've got just under 30 clinicians actively involved on a daily basis with commissioning services for their patients. These clinicians are spread across all of the practices within Newark and Sherwood, and I'm really, really proud that over the past couple of years we've got all of these people on board to help design services for our local population.
We've got a very active stakeholder reference group, and that brings together people with quite a range of interests and across the whole of the geography of the CCG, and we use them as a sounding board for new ideas. We also go out much wider. We've put on a number of public events over the last year, and they've been generally very well attended, and we've received some very, very good ideas from members of the public about what we should do with services, and that always helps us with our plans for the future.
I want to be a patient rep for PRISM because during the last 2 years I've had to retire due to ill health, and my husband unfortunately has cancer, and it's made me realise how important it is to get the right care for each other. I owe my healthcare team something back because they've helped me, and it also gives me a chance to speak out and get the best care we can for people in our local community. Given the new health bill, we can truly say what's needed to make things better for people.
We're looking at all sorts of different angles to improving end-of-life care for our patients. We have a high number of patients here, which is likely to go up a lot within the next 10 years. We're working very hard with other care providers across all sectors to try and improve patient experience and patient pathways. We're linking in with national bodies in order to help us do that, and we hope that the sort of creative approach that we're trying to promote here with integrated team working will rub off on hospitals as well, and that we'll really be able to engage meaningfully with them.
I don't think that anybody wants to meet that conclusion that they are going to die, but I think you've just got to treat the patient with the dignity. And once you have that meeting after that patient's passed away, you look back to see if all of their needs have been met and they have achieved their preferred place of death, they have achieved their last wishes, then I think that's quite rewarding, that you've been involved in that patient being able to pass away how they wanted to pass away.
I feel quite privileged actually, because it's a subject that I'm passionate about, and I'm really grateful that the CCG has it as one of their priority areas.
It opens up new avenues of engagement. It also creates an even platform for members of my community to engage with the settled community. And already in this short space of time, we're seeing the community progressing.
If we can communicate our culture and have an understanding of the Gypsy and Traveller community and culture, then we can break down these barriers that we've got in accessing healthcare.
So, of course, the whole community is looking at this as a pathway towards their future, towards a positive future.
The thing that I enjoy most is knowing that someone out there is getting a better understanding because of the training that we have given.
I see by doing what I do, facilitating projects such as this, that then maybe when I've got grandchildren, they're not going to have the same issues with the healthcare as what I've seen throughout my lifetime.
I've educated myself by the people I meet, and I feel proud to be who I am. I'm proud to be able to mix with the service providers and be able to help my own community. I myself have had 15 children, we're 12, adopted 2 children. I've got 53 grandchildren and another one on the way quite soon, and 1 great-grandchild. And I feel now, at my age, that I should put something into this community and this country and this time for them.
Our main aims and goals for the next few years are to make sure that we improve the health of the people within Newark and Sherwood. We want people to live longer lives in a better environment with more joined up care with high quality service provision.
We want people to be proud of their local NHS, that's our key aim, and we want people to be treated with respect and dignity in the services locally.
Newark and Sherwood Clinical Commissioning Group have some very ambitious plans for the future and how to deliver healthcare for our local population. I feel proud to be part of Newark and Sherwood Clinical Commissioning Group, and I'm absolutely sure that over the years to come we can deliver services to our patients that not only they're proud of, but also us as an organisation are proud of as well.